Burns and scalds damage the skin causing by heat. If someone has a burn, they will develop shock and need to hospitalize as soon as possible. What we need to do? Move them away from the heat. Then, cool the burn and running water at least 10 minutes. This can help assist the damaged tissue and increase risk infection. When the burns is cold, cover with kitchen film, lengthways. Use plastic bag if you don't have kitchen film. This may increase the risk infection. Do not use gel because this is not recommended. Remember, move them away from the heat source. Place the burn under the cool running water at least 10 minutes if it's serious. So, call 911 for emergency if the burn is serious.
A break or crack in the bone is called a fracture. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound, not over the protruding bone to control any bleeding. Support the injured area. For example, fractures on the arm can be secured against the body with a sling. A fracture to the leg can be secured to the uninjured leg with a triangular bandage. So remember, pad and support the injured area. Use a sling or a triangular bandage to keep it secure. Cover any wounds. That's how you treat someone with a fracture.
To bandage somebody's hands, use a roller bandage. Wrap the bandage straight around the wrist. Then, wrap the bandage from the inside of their wrist diagonally, across the back of their hand up to the nail of their little finger, straight across underneath the fingers, and diagonally back across the back of the hand. To the outside of their wrist, pass the bandage under the wrist and repeat diagonal over the back of the hand, across the fingers and back again. Keep going the same way, bandaging diagonally across the hand, like a figure of 8. By each time you only cover about the 2/3 the figure's layer. Each new layer should be covering a third of new skin. Make sure you leave the tips of their fingers peeking through. Once you cover the whole of the hand, wrap the bandage straight around the wrist of the couple times. Wrap the bandage straight around the wrist a couple times and secure with a pin or tape. Squeeze the fingernail for 5 seconds. When you let go, if the color doesn't come back within 2 seconds, it means the bandage is too tight and you need to loosen it a bit. It means the bandage is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, when applying a hand bandage, use a roller bandage and make sure the bandage extends far beyond the injury site.
How to make an arm sling. First, ask the casualties to support their arm with their other hand. Gently slide the triangular bandage underneath the arm. The point of the triangle should be underneath the elbow of the injured arm. Bring the top of the end of the bandage around the back of the neck. Second, fold the lower of the end of the bandage up over the forearm to meet the top of the bandage at the shoulder of the injured side. Third, tie the two ends of the bandage together in a wrist knot above their collarbone and tuck in the free ends. Fourth, adjust the sling so that it supports their arm all the way to the end of their little finger. And the last is, make sure that the edge of the bandage by the elbow is secured by twisting the fabric and tuck it in or using a safety pin to fasten.
Fainting happens when a person loses its own consciousness suddenly. What causes fainting is pain, exhaustion, hunger, stress, and standing or sitting when it's hot. Signs of faintings are strictly unresponsive, pale cold skin, and sweating. If someone is fainting, lie them down, kneel down next to them, and raise their legs while supporting it to your shoulder or to a chair to help blood go back to the brain. Make sure that the patient will inhale fresh air. When they respond, help them sit up slowly. They should respond in a couple of minutes, and if they did not and remain unresponsive, then prepare to treat an unresponsive casualty.